Welcome back to Health, Home, and Lifestyle. For this week, suicide awareness is very important, and therefore I had a chance to talk with Dr. Annette David, who shared why Guam and suicide are somehow connected and what we can do to prevent suicide on Guam. With me is Dr. Annette David, who will be speaking in front of the Hagu Foundation and a lot of other people to talk about suicide awareness. So Doc, suicide on Guam, is it? I guess is there a lot?
Yes, Daniel. For many years now, it's always been in the top 10 causes of death here in Guam. And I think very importantly, if you compare our rates with the rates in the U.S., our rate is more than twice what you see in the U.S. So it is a very significant health issue, a priority here in our island.
So Doc, for those, I guess, who take their lives, is it a certain age group or is it like a mix and match of every age group?
So we've been tracking the data for suicide here in Guam for almost 2 decades now with the Guam State Epidemiological Outcomes Work Group, which is based in the Guam Behavioral Health and Wellness Center. So one of the things we found is that here in Guam, suicide is a phenomenon of the young. So in fact, about half of all the suicide deaths over the past 10 years have been in people under the age of 30. And if you compare that to the US, the age group with the highest suicide rate in the US is 85 and older. So it's a very different profile from what they see in the mainland. Here, it's a phenomenon mostly of the young.
Doc, so since there's such a big difference between the mainland and here, I just sort of wanted to ask, the incident that recently happened in Texas with the elementary kids and that 18-year-old who killed.
So tragic, right?
Very, very tragic, sad news. Do you think he planned to do that, I guess, as a way of suicide by cop, or?
I don't know. I mean, it's hard to tell, right? But I think the takeaway there is you don't make access to guns easy for people who have mental health problems. And so that could have been prevented entirely if people had sound gun control policies in Texas. Unfortunately, they don't. So they've had so many mass shootings. I think we are more fortunate in Guam because we have more evidence-based policies here. But definitely, anyone with mental health issues, they should have access to good mental health support. It's so important.
So Doc, just to backtrack a little bit more, do the suicide rates here on Guam have something to do with depression or any other mental disorder?
Well, it's interesting. We don't have complete data because for that you have to do something called a psychological autopsy, which is in-depth interviews with family and friends, and we don't have that data right now. What we do know is that some of the correlates of suicide here in Guam have been having had a mental health diagnosis, having attempted it in the past, and the use of drugs and alcohol. So these are some of the red flags that can be used to help people identify who's at risk so that they can reach out and get that person safe into a safe space.
So Doc, I guess, are there ways for family members and friends to catch those signs of their loved ones who, is thinking of maybe taking their own life?
You know what's so important is to reach out. If you think someone's having a hard time, don't be afraid to ask, are you okay? And be prepared to listen to them. And if there's any sort of indication that they might be thinking of suicide, get them to help immediately. Now, there are community trainings that are available through the Guam Behavioral Health and Wellness Center. Anyone can take them, and they will teach you the skills for suicide first aid. So I would recommend everybody to take the Safe Talk or the Assist training. It's all for free, and I think we need it because most suicides here, they happen in the home. And so it's not something that a healthcare clinic could pick up likely, or it's going to be the family that will be there the closest to pick up the risk and to intervene. So it's important for all family members to know how to make use of suicide first aid interventions.
So, Doc, the older generation, they have this mindset of, oh, this is just a phase, and even if their loved one tries to talk to them about it, they just sort of brush it off. Is there something you would like to say about that?
You know, the evidence tells us that when someone indicates that they're thinking of suicide, you need to ask them directly, are you thinking of committing suicide? And if they say yes, you need to get them to help immediately. Very importantly, Guam is about to launch its suicide helpline, the 988 helpline. And so when that comes online, that's going to be a very valuable resource. But in the meantime, we do have the crisis hotline, and we do have resources in the community. So important to know what those are. So if any of our loved ones are ever at risk, we can get them to safety quickly.
So, Doc, I guess just to wrap everything up, could you just share what you'll be talking about here at the Hagu Foundation on
Right,
suicide?
I'm going to be sharing with them the data from the 2020 Chief Medical Examiner's Office on Suicide to talk and also to see how can community groups like the Hagu Foundation help in creating a stronger suicide prevention infrastructure here on island. It's all about partnerships and collaboration.
So, Doc, for our viewers who will be watching this, and especially if there is one who happens to catch this and they're thinking about it, is there anything you would like to say to them?
You know, if you feel hopeless and depressed or anxious, reach out to someone and know that there are people in our community who are ready to help. Know the crisis hotline and also reach out to people who may be able to assist you to get over whatever crisis you are going through. There is hope.
Thank you so much, Dr. David. We'll be right back with more Health, Home, and Lifestyle.